Hello, my friends. I'm Dr. Schulze, and this week I have a letter from John B. from Daleville, Alabama. Sweet home, Alabama, and I love getting letters from men. I don't get enough letters from men. Dear Dr. Schulze, my name is John B. I'm 50 years old. My father died after 2 treatments of chemo for rectal cancer at 70. I have 2 first cousins who both died after chemo, and another first cousin who had colon cancer surgery and know their treatment and has survived 5 years. So what's the message we're getting here? Chemotherapy kills. Okay, how many people do you know? Obviously a bunch in your family, and I know that I think if they never went in the hospital, they'd still be alive. If you look at what's killing people from cancer, it's not the symptoms of cancer. It's not their body rotting. It's the chemotherapy. In fact, in many studies I've read, 3 groups of people. One group of people have cancer. They aggressively treat it with radiation, surgery, and chemotherapy. They die the fastest. There's another group of people in the middle who don't do anything. They live longer, just rotting away with cancer. They live longer than those that took chemotherapy, surgery, radiation. But what about the group that do something positive, focus on the good to eliminate the bad? Well, my patients that were supposed to be dead 20 and 30 years ago, they're still alive. They had cancer that were supposed to be dead. Okay. My mother's twin sister had colon cancer surgery and no other treatment 20 years ago. She's still alive. What's the message here? Chemotherapy kills. Okay. I was diagnosed with colon cancer on November 30th, 2012. I was about to turn 50, so in preparation for my 50th birthday tune-up, as I was instructed to do, I had blood work which determined that I was anemic. My hematocrit was 34. After the tumor was found, the surgery was performed. It was determined that I was stage 3A, meaning 23 lymph nodes. I get bored. You know what I did with all my patients? X-rays, CT scans, with all their tests, all their blood work. I threw it in the trash. It bores me. I focus on the good to eliminate the bad. I'm not into all the disease stuff. My PT scan was clear, so I was labeled radiologically cancer-free. However, it was still suggested that I undergo 6 months of chemotherapy. You know what it did to your relatives? It killed them. Just in case a few cancer cells got loose and it was going to come back somewhere else. Fortunately, I started listening to that little voice in my head that said, no chemotherapy. That's what the voice in my head says. Listen to your inner voice. It's the voice of God within you. I decided to do as you say and get very healthy. I cut out meat except fish and organic chicken occasionally. I know you're from Alabama. Hopefully you cut out the fried. I stopped once and ate in Alabama. They even had fried lettuce on the menu. I never had indigestion like I've had in the state of Alabama, my friend. I cut out dairy, sugar, fried foods. Thank you. That answered that. I cut down my bread by 90%. I started taking a double handful of supplements and juicing every day, but I think I need to simplify my life and found your website and started reading your advice. It makes a whole lot of sense. I make a lot of sense. I'm a common sense kind of guy. Now I get to my question. My tumor is just above my cecum, which is the lowest part of your large intestine. So they removed 6 inches of my small intestine where it attaches, probably your ileocecal valve, the cecum, the appendix. Sorry to hear that because your appendix is an immune aggregation. It is part of your immune system, but don't worry, you have backups that the doctors didn't get. And 8 inches of my large intestine. They put the 2 ends back together and my bowels started working within 2 days. I've been very regular, mostly I think because of my diet. What I really need to know is whether your bowel cleanse is too intense for someone who has had part of their colon taken out. No. You still have a lot of your colon left. It sounds like they just took out 8 inches and a little bit of your small intestine. So you can do the colon cleanse. Remember, the people in my clinic that died because they didn't do enough, not because they did too much. And what's the worst case scenario? I would have been much more worried about undergoing surgery where they removed my appendix, where they removed my cecum, where they removed my small intestine, where they cut 8 inches of my large intestine out of my body, and you're worried about taking a few herbs, brother? You need to suck it up a little bit, John Free from Alabama. I know you Alabamans. You're tougher than that. You're more powerful than that. Forget about this fear. Get rid of it. Get on the bowel cleanse. If you overdose on herbs, what happens? Maybe you vomit. Maybe you have a little diarrhea. Don't worry about it. You can do it. Do the bowel cleanse. In fact, I would do everything. You need to do everything. You need to start with your food program and get it even cleaner than you say. I don't like the fish. I don't like the chicken. You don't need that bacteria in your body. You need, if you're not going to do chemotherapy, then I need you to do something just as powerful as doctors' chemotherapy, because they are boiling down the most poisonous chemicals in the world to put inside your body to kill cancer cells. If you're going to not do that, then I need you to do a program that is just as intense and just as powerful, and that means I need you to be a vegan, brother. I need you to get off of all animal foods. I need you to get your diet not good, not better. I need it perfect. I want you to do the bowel cleanse. In fact, I want you to do every cleanse. I want you to do the 30-day detox, if not the entire Incurables program. I want you to move your body every day. I want you out there doing aerobics and sweating. I want every detox. I want a physical, emotional, and spiritual makeover. I want you to do so much work that in a year from now, you don't even know who you are anymore. When you do that, then I know we didn't need chemotherapy, forget about that, and I know you're cancer-free. But you got to put the pedal to the metal, brother. I want maximum. I want maximum out of you, okay? And so far, I like everything I hear. I was also interested to know what you think about coffee enemas. Not necessary. I've never been a fan of coffee enemas. They're not necessary at all. Use the bowel detox program, but do everything I said. Remember this. John from Daleville, Alabama. The doctors cut a whole bunch of your guts out. Okay? All of these guts you needed. They were given to you by God. All of them you needed. So you're a little bit impaired right now. Okay, on top of that, the doctors want to put highly toxic, concentrated, poisonous chemicals into your body because they're afraid. Because you know why? Because cancer comes back. You had cancer, but cancer comes back 3, 5, 6 years. Look at the results. I want to make sure cancer doesn't come back with you, and you're not just in remission, but you're healed, brother. I want a miracle. And the way we're going to do that is by a complete life makeover, a transformation. I want you to focus on the good. I want you to focus on the great. I want you to change your life so much. Like I said, a year from now, you don't even know who you are anymore. And then I'll be guaranteed that I'm going to get you, you're 50, I want you to live to be 163. Okay, that's what I'm working towards. I don't know what you're working towards, but that's what I'm working towards. And to do that, I need a complete life makeover. You can do it, John B. I know you're a tough guy. So let's get started. Let's create powerful health and live cancer-free for the next 95 years. Thank you.